As Dr. Lee said, I'm a retired Army general, medical corps officer, and a psychiatrist. I think I'm a bridge between this panel, the kinds of remarks that we heard from Admiral Smith and Professor Kuznick, everyone here, and the next panel on mental health. Because I want to speak specifically to the issues of fitness for duty and for dangerousness as we evaluate people in our respective roles. That is, our work as military physicians, we were called on frequently. It was fundamental to our practice that we would do evaluations for fitness for duty. We had to respond to a request of our leaders to say, should this person be cleared here, have a security clearance? Can this person be put back into the cockpit? Should this surgeon go into the OR? We have what we call the nuclear surety program. Should this person have access to nuclear weapons? Now, that was the call of the leader. That was the decision of the commander to decide who was going to be assigned where, what their responsibilities were, and what authority they were going to have. Our position, my position as a physician, was to evaluate, to advise that leader about what I knew about that person's health and their mental health, and to see if there was if there was a problem in the way that that person was currently experiencing that may interfere with executing those duties. And you heard a very elegant statement from Admiral Smith about what it takes to have a senior leader. The interesting problem that we have is that that our Congress, and I think that both Professor Payne and others, has been AWOL on taking the one step that they could take to best decide, at least start to explore what those criteria could be for what a president should, in fact, show and demonstrate to be effective. And that's because they have not taken on being able to further specify and define Section 4 of the 25th Amendment. Paul Sommergrad, a former president of the APA, and I wrote about this in 2018. We said very clearly that this was something that was extremely important as we looked out. I mean, we've had a number of presidents that have really already, we know, have had health problems, right from Woodrow Wilson, the stroke he had, Franklin Roosevelt, with clearly cardiac problems early on as he was going through that. Eisenhower himself, President Eisenhower, had a stroke in '57. He was the person who first started the conversations about the 25th Amendment. And then, of course, there's a whole question of Ronald Reagan in '86 and his capacity to be able to attract. It doesn't take a lot of imagination, really, to say, at what point in time are we going to have an individual as commander-in-chief who has some problem that clearly is impairing their capacity to function? And who is going to be able to discern that? Well, of course, it's the immediate advisors. It's the people around that leader who say, he doesn't track. He doesn't understand what's going on. He's not inquisitive. Frankly, as it was with the case that people felt about Richard Nixon, he doesn't show the character. He doesn't have the temperament. He doesn't have the integrity. Those people need to speak up. And when they speak up, that goes to the Congress, and the Congress goes through the process of the 25th Amendment. Well, we have a completely dysfunctional AWOL Congress. So where does the power lie then? Who do we as military physicians have to speak to? As you've heard, truth to power. That's our role. My job, many, many times as an Army doctor, was to say what nobody else wanted to hear. To go in and say, in these cases, they're men, so I'm trying to be, not to cross any lines here, but, I grew up in an old Army, I'm an old man. And I'd say, sir, this person can't do his job. This is going to be dangerous. We've got to do something. Well, Steve, if I say this person's got a mental health problem, that's stigmatizing. You've got to tell me more. And that was my job. And by the way, that's different to say about fitness to duty than, in fact, what many of my colleagues feel, that we circle around diagnosis. It's not about that. It's really about, does this person have the skill sets? They're like an artist or an athlete. Do they have the capabilities to do the job that they're being asked to do? One factor that goes into it is what we know about their health and mental health. So that's a very important factor here. I believe we need to be able to make sure that we state that clearly to our public, because the people who need to understand that, if our country is going to go in the right direction, if we're going to be able to save our country, are those young people sitting on the couch who may not want to vote, who have decided to abdicate their roles and in my view, their responsibilities as citizens, or the swing voters. This is something that most people is beyond their usual scope of their work and their daily lives, because most of us function in a very clear way. We know what's best for us. We're now saying, no, this is broader. So we have the issue of fitness for duty, and I think it is different than a diagnosis. I think it's also different than what many of my colleagues do is a forensic evaluation. You've seen that, you've probably seen it on television. Is this person insane? Are they competent? Those are different evaluations, and I've done a lot of those over the many years. This is specifically about, can this person do his job or her job? Now, the second is dangerousness. How do we see the issue of dangerousness, which we also have to make a judgment about, and to tell and explain that this person that we know that we're going to elect, we have a reasonable suspicion and maybe conviction that this person is dangerous. It's interesting, as I was preparing for this, I also had a chance to read some remarks, paper by Jack Goldsmith. I'm not a lawyer, in Lawfare on immunity, that I actually sit on executive boards with Professor Finkelstein, and I'm a member of all transparency of the National Leaders Group, so I'm clearly a biased individual. But he was talking, and when he's talking about the immunity rule, that in the law, or I guess in the concepts, there is the thought of the bad man president. What do you do when you have an individual, in fact, who won't follow the rules, refuses to expand them, but essentially feels is beyond those laws and rules? And do we have the checks and balances in our government to make sure that that person is constrained and does not carry out those dangerous acts? It's a big question now, what's been going on in the Congress, if that's the case. And so we don't know if those rules and laws can come in play here. The interesting thing that we have is there was a circle around President Trump, who at times will come and speak and tell the stories about what it was like working with him, about how fit he was and how capable he was in that position. And the particular one that stands out is a book by John Bolton, so The Room Where It Happened, his White House memoir. And he talks about he says that the president has systematically governed with single-minded instinct for looking at issues entirely through the prism of what is good for him and not what is good for the country. And others advisors have said the same thing, but I think they've made a fatal error, at least one. And that is that they have failed to effectively appreciate and grasp what how hard it is to work with such extreme characters, with such autocrats, with such despots, because these people, unfortunately, have a kind of genius about what they do. They cannot be controlled. They can't be managed or outmaneuvered, and he was not. So any game played on their field gives them an advantage. This is really worrisome. Now, Dr. Summergrad and I agree with the admonition from our professional association, the American Psychiatric Association, that we should not be able to render a specific medical opinion about someone who has not been examined by us. And we believe that the rule, we endorse the rule, and that it does violate our medical ethics. But we know what, and the science of psychology, the science of mental health tells us what the character is like of autocrats and despots and how they succeed. That we know, and that we can talk about, and that is what we should be educating folks about. We know that these people see the world through their outsized lens. We know that they feel no restraints in terms of exercising power. We know that they are willing to hurt someone else. They're complete, almost impersonal. Everyone is an object. Everyone is there to be used. We know that. And so we are obligated to say it, to explain it, and that it is dangerous. What's the maximum? See something, say something. And that's what I think is what we're obligated to do going forward. There's one more factor here that we have to take into account. And this is a time to maybe hoist on the man on his own petard. Donald Trump, if elected, and however messy this election would likely be, is going to be 78 years and 220 days old, the oldest person to ever be inaugurated in the office. We've already seen plenty signs of cognitive decline. We know how this plays out. Any one of us who have taken care of family or been around others and watched that process, we know what that mentality is like. We've listened to him. We've had people say that this is not one of the people who presented, men who presented, played him for debate preparation in 2016 and 2020. This is not the same person who I was studying to prepare for the debates. The rambling, the looseness, the failure to grasp details, the failure to be able to talk through issues. This is not the same person. So it is completely expectable that we will see a serious decline if this man is elected to the 4 years of his office. That should worry everybody. That should worry us all. And it needs to be said. I mean, it was clearly the story, and it ended up with President Biden deciding not to run anymore. There's a lesson learned from that. And we need to take that lesson and make sure that that's also communicated. So with my fellow military officers and senior leaders, and all of you, I mean, we share our pledge. As officers, we take the oath to the Constitution to defend the country. This is what we think is right. It is our country and what we put it as a priority. And I think it is up to us to speak truth to power. The power rests with the American people, and to give them the knowledge and the tools so that they feel that they can independently and effectively make the right decision. And that's what we're here to do, and I appreciate the opportunity to be able to speak up about it. Thanks so much.